This is Kristen Elliott. I'm going to discuss with you pharmacologic principles. This is chapter 2 for nursing pharmacology. So the first thing we're going to discuss is what is a drug. A drug is any chemical that affects the physiologic process of a living organism. Pharmacology, as we know, is the study of drugs. Now I want to talk about drug names. So we have 3 different forms of drug names. The first is chemical names. Let's see. And as you see down here, this is the chemical name. So our chemical name is this long fancy name that I'm sure we all learned in chemistry. You don't need to know that. So next we have the generic name. And so this drug down here is Motrin. Motrin is going to be the trade name. The generic name is ibuprofen. Our generic or non-proprietary name is a name given by the United States Adoptive Names Council. The trade name, also known as the proprietary or brand name, in this case would be Motrin. This drug has a registered trademark, and the use of the name is restricted by the drug patent's owner. So Motrin is a trademark name. So if you go to Kroger, CVS, or Walgreens, their generic form is going to be ibuprofen. They cannot use the name Motrin on their drugs. Whoever Motrin's manufacturer is the only place that can use the name Motrin. That being said, all of these drugs are ibuprofen. In this course, we are going to go by the generic name. The generic name is beneficial because it can be a common language that we use to speak to each other about the drugs. All right, so next we have some terms. And these terms will be important to know, but we'll go through each one. Pharmacokinetics. This is what the body does to the drug. So say you take ibuprofen. Pharmacokinetics is what your body does to the ibuprofen as it is consumed and broken down. Pharmacodynamics is what the drug does to your body. How does the ibuprofen work within your body? The mechanism of action, and we'll talk about this throughout the course, is how the drug works. Ibuprofen works by stopping prostaglandins, which result in decreased pain. Next is therapeutic uses. This is why we use the drug. Ibuprofen we can use for headaches, we can use to decrease fever, we can use for musculoskeletal pain. So pharmacokinetics has 4 parts. If we imagine here, this is our ibuprofen. And remember, pharmacokinetics is what the body does to the drug. So this medication is going in. The first step is absorption. Absorption is how the drug gets in the body. 2 is distribution. Where will the drug go? 3 is metabolism. How is this drug broken down? And 4 is excretion. How does this drug leave? So our pharmacokinetics within the 4 principles: absorption, distribution, metabolism, and excretion. So I remember this up here at the top, ADME. Those are our principles of pharmacokinetics. That's how you'll remember. All right, so we're going to talk about each of these individually, which I think is helpful to understand what is pharmacokinetics. So in this case, I'll show you a video, and the person is taking aspirin. So absorption, which is how the drug will get in, is displayed in this video.
After swallowing an aspirin tablet, it will go on a journey through your digestive system. Absorption. The tablet will travel down the esophagus into the stomach, where it is dissolved into much smaller particles. These particles will continue their journey into the small intestine, where most of them will be absorbed into the blood. The small intestine walls, also called lumen, are lined with tiny villi which stick out to provide a large surface area for the nutrients inside the food to be absorbed. Looking closer at these villi, you can see they have a rich blood supply, and they are covered in a thin layer of epithelial cells. The aspirin molecules will work their way through the epithelial cells and into the bloodstream, where they are carried around the body.
So we see from that video that absorption is the movement of drug from the site of administration into systemic circulation, which is the bloodstream. So the aspirin was taken in through the mouth, it was dissolved down, and it moved from the intestinal villi into the bloodstream. And this all occurred through the membrane. So as we could see here, diffusion, these are different ways that this can occur, but they all involve getting the molecules of the drug across the membrane. And our biggest concern here is that it's going into systemic circulation. It goes from the site of administration across the membrane into the bloodstream. We have 3 routes of administration. And these routes are enteral, parenteral, and topical. So these are 3 categories of routes of administration. And we'll talk much more about this in chapter 9, when we're talking about how do we give meds. But I want you to look at these categories, and it will be helpful as we go through pharmacokinetics. So our enteral route is anywhere that's going through our GI tract. These are things taken by mouth, sublingual or buccal, and rectal. Parenteral is injected into the body. So a needle is involved here. So it could be IV, through your muscle, through your fat. And then topical is applied to the body surface. This may be a cream, an inhaler, a suppository. We do have some factors that can affect enteral absorption. So how does this medication get across the membrane into your bloodstream? These include food and fluids administered with the drug. Some drugs require the medication to be administered on an empty stomach. Some don't matter. The dosage formulation. If I'm taking a liquid medication, that may be easier to absorb than an enteric-coated medication. Is the membrane working? Is there something in your stomach that's causing a challenge, such as Crohn's disease or a stomach ulcer? How much blood is flowing through your stomach? How acidic is your stomach? And how fast are you moving things through? If somebody's having diarrhea, that medication may not have the opportunity to absorb, and this can cause it to be flushed out. Our next step in pharmacokinetics is distribution. Here, the aspirin has already absorbed into the bloodstream. Now it must be distributed to the tissues.
Distribution. Blood plasma contains complex molecules called albumin. Albumin is a protein made by the liver which transports nutrients around the body. Albumin also binds to drugs that enter the bloodstream. Here you can see some of the aspirin molecules binding to the albumin. All the aspirin particles that have been bound will be filtered out as they pass through the liver, and only the remaining aspirin molecules will get through and have any effect on the body. different drugs will bind to albumin in different amounts depending on their affinity for plasma protein. The next stop on the journey is the liver. The aspirin-rich blood will enter the liver through the hepatic portal vein at the bottom, and it will exit at the top via the hepatic vein. At this stage, even more of the aspirin will be removed through a process called first-pass metabolism. The liver's job is a bit like a filter. It will metabolize drugs before they reach the rest of the body.
So as you can see, the aspirin was distributed through the bloodstream after it was absorbed. Distributing takes the drug and transports it to its site of action, which is where it needs to go. Drugs will be distributed first to areas with extensive blood supply, such as the heart, liver, kidneys, and brain.